If you're trying to figure out the most affordable way to cover healthcare before Medicare, here's a simple decision framework. Option number 1, ACA Marketplace and Subsidies. For most early retirees, this is the best place to start because ACA provides real, fully compliant insurance. And the great news is that they're income-based, not asset-based, and that is a really powerful tool for early retirees. Premium tax credits can significantly lower monthly costs. Cost-sharing reductions can reduce deductibles if you choose a silver plan. And in expansion states, there is also a Medicaid floor for very low incomes. When this option works, it often works extremely well. And this is why so much attention is focused on Congress right now. For many middle-class early retirees, ACA subsidies are what make early retirement feasible from a healthcare perspective. Without them, affordability becomes much more challenging in those years before Medicare kicks in. And as far as what's going to happen to the enhanced subsidies, we likely won't have a final answer until early 2026. Option number 2, spouse or partner employer plan. If you have access to this one, this is often one of the simplest solutions. If your partner is continuing to work through an employer who offers health insurance, this is often going to give you very robust coverage at a much more affordable point than, say, an ACA plan, and often gives you an expanded network. Employer plans are often very robust and very affordable. After all, when it comes to individual coverage, the employer often subsidizes about 80% of the insurance premiums. When it comes to family plans, they often subsidize anywhere from 70 to 75% of the family premiums. This can be an excellent option if one spouse wants to retire today and another spouse is happy to continue working. However, if both spouses want to retire at the exact same time, this plan isn't going to work because it's very likely once employment stops that health insurance stops. Option number 3, COBRA. Think of this as a short-term or temporary bridge, not a long-term solution. COBRA generally allows you to keep your existing healthcare plan from your previous employer for up to 18 months. And this can be incredibly valuable if you liked your previous plan or if you're in the middle of care. But the trade-off is cost. Under COBRA, you usually pay 100% of the premium, plus a small administrative fee. In most cases, it's a 2% admin fee. So if your employer plan costs $800 a month total, even if you were only paying $150 while working, under COBRA, you're now going to pay about $816 a month, entirely out of pocket. That's why COBRA can feel so expensive, but it can be worth it for a short period of time. Say you're in the middle of treatment or you're just phasing into retirement. One more important practical note that I want to add here, and this just comes from experience in the insurance field. There is a temporary gap when COBRA is being set up from the time you leave your workplace to the time COBRA kicks in. During that time, your insurance can appear inactive, and if you see a provider during this time, you may get a denial and an explanation of benefits saying you are not eligible for coverage. Don't panic. COBRA coverage is retroactive, and after a period of time, once the transaction between your HR department and the insurer are finalized, you can get those claims resubmitted for proper payment. It's a little paperwork heavy and it's kind of annoying, especially for patients and those on the provider side, but it does eventually get resolved. So, COBRA works best as a short-term bridge, a way to preserve a high-quality employer plan, or a tool to get you to the next enrollment window, often the ACA Marketplace. Just don't plan on it being a forever solution. Option number 4, part-time work with benefits. You could think of this one as benefits arbitrage. Some early retirees intentionally take low-stress or part-time positions, specifically for health insurance. Schools, universities, hospitals, and even government roles in some large employers often offer benefits that can actually beat unsubsidized ACA plans, especially between the ages of 55 and 64. For many people, this allows for a phased retirement. You maintain social connection, some structure, a sense of purpose without having to stay in a high-stress full-time position. Not everyone wants to jump right into full retirement, and if meaningful part-time work appeals to you, this can be a really graceful way to enter into a phased retirement and control those healthcare costs, and maybe make it so you're not yet drawing on your portfolio and making your retirement a little more robust. Option number 5, military or federal coverage if eligible. If you qualify, these are some of the best deals available. Federal employees and military retirees are some of the best positioned people for early retirement. If they especially have a pension and access to continued health care, this combination can make an early retirement dramatically easier. Suddenly, you have income stability and access to very affordable, high-quality health care. Programs like TRICARE and FEHB often offer comprehensive coverage at a fraction of the cost of private insurance, assuming you meet the eligibility rules like the FEHB 5-year participation requirement. If you have access to one of these systems, it is a major advantage. Option number 6, Medicaid if your income is low enough. For low-income households, Medicaid is worth mentioning. However, for those households planning an early retirement, it's likely they're planning a retirement where they're able to have an income that supports their targeted lifestyle. So generally, Medicaid is off the table. Medicaid eligibility is income-based, and in expansion states generally kicks in around 138% of the federal poverty level. It's a safety net for those with low incomes and an incredibly important social program. However, if you're actively watching financial planning content and planning out an early retirement, Medicaid is generally not the avenue you're targeting. Still, it is part of the landscape for those who need it. If you're trying to decide how to cover health care before Medicare, this is the order I'd think through it. Step 1. Do you qualify for TRICARE or FEHB? If the answer is yes, start here. These systems are really the gold standard for early retirees. Predictable, comprehensive coverage at a fraction of the cost of private insurance. If you're eligible through military service or federal employment and meet the criteria, this is your simplest, most affordable option. If the answer is no, keep going. Step 2. Can you keep your income in a subsidized ACA range? This is often the most important question for early retirees. If you can reasonably manage your modified adjusted gross income, using portfolio withdrawals, Roth money, taxable basis, or capital gains control, then the ACA marketplace with subsidies is often the best long-term solution. This is where early retirees can have the advantage. You're not a W-2 employee anymore. You can have the option to shape your income. And if you can stay within acceptable ranges, you can have dramatically lower healthcare costs before Medicare ever kicks in. If the answer is yes, an ACA market plan is likely your best course of action here. If the answer is no, you can continue. Step number 3. Do you have access to a spouse plan or a benefits-eligible job? If you do, it is absolutely worth comparing costs. A spouse or partner's employer plan or a part-time job with benefits can sometimes beat unsubsidized ACA coverage and often comes with a stronger provider network. This can be a really great solution if one spouse wants to continue working and the other wants to retire. If that's not an option, then you want to start comparing COBRA, continuing your pre-existing healthcare from your prior employer, and unsubsidized ACA plans. And this is where timing really matters. COBRA usually makes sense when continuing care matters more than cost, at least temporarily. For example, you're mid-treatment or managing a chronic condition. You have a very strong employer plan and want to keep your doctors. You're leaving work mid-year and want to avoid resetting deductibles. Or you're within a few months of ACA open enrollment or Medicare. In those cases, paying more for a short period of time can reduce risk and reduce stress. Here's what that strategy might look like. Use COBRA for the rest of the calendar year, and then switch to an ACA plan during open enrollment. This avoids having your deductibles reset, and this can give you the time you need to plan out your ACA income. Now, ACA plans tend to win when you're fully retired, not just transitioning. When you can control your income to qualify for subsidies, when you're planning multiple years before Medicare, and cost predictability matters more than staying in one exact plan. Over time, ACA subsidies can save you tens of thousands of dollars compared to staying in COBRA. Now, COBRA can absolutely be expensive, but there are situations where it would make sense despite its cost. COBRA can make sense if your employer was covering 70 or 80% of the premium, and the total cost is still reasonable to you. If you've already met or are close to meeting your deductible and your out-of-pocket max, or you want to keep your exact doctors, your hospital, and your prescriptions, and you're within 12 to 18 months of Medicare. Here, COBRA is really serving as a controlled, intentional bridge. But if you have a much longer runway before Medicare is kicking in, ACA is generally a better longer-term option.